So I'm Chris, as mentioned. I'm on the Medicine X Executive Board. Full disclosure, again. Most importantly, for the sake of this conversation, I'm living with type 1 diabetes. And I'm going to talk about this thing I created. This thing I created called My Diabetes Secret. If you're a fan of PostSecret, then some of this conversation will likely ring true. Are you guys okay? Can you see the slides? Am I going to? Okay, cool. All right. So first, some ground understanding. Diabetes is type 1 diabetes. This one that I've got. Your body does not produce insulin, which is a hormone that is needed to convert sugar, starches, and other food into energy needed for daily life. The fun thing about especially type 1 diabetes is that the thing that I need to keep me alive, insulin, I'm supposed to dose it myself, but it could also, if I'm careless with it, it could kill me, which is it's a harsh reality, but that's just what it is. There's a fun balance of managing the highs and lows of diabetes day in and day out. Type 2 diabetes is when your body does not produce insulin properly. It's called insulin resistance. So that's basically your pancreas is trying to produce the insulin, but it's overworked, and eventually you're going to eventually develop full-blown type 2 diabetes. Diabetes is not, however, caused by eating too many sweets as a child. It's not caused by drinking too much soda. It's not a punchline to jokes. It's not easy, and it's not fair. I put the source as reality here, and I was talking with my wife about if that was actually too harsh, but and seeing things like what CrossFit decided to say a couple of weeks ago, there's a big public perception about what diabetes is and what it isn't, and hopefully tonight I can maybe enlighten one or two minds in case you weren't aware of what it is and what it isn't. And I don't know, it's a difficult thing to try and pay it forward and try to educate everybody, but diabetes is a big deal, and it's a serious thing, but it's also easy to misunderstand, and as a result, there's just a whole bunch. There's a lot of bad that can happen as a result of the lack of knowledge and the lack of understanding there. Yeah, that's all I got for that one. But the Diabetes Online community, which is kind of an extension of what I'm up here to talk about, we are everywhere. For example, on Twitter, if you look at the hashtag DSMA, tomorrow night, there's a Twitter chat. Actually, it's tonight. Is it tonight? Sure, it's going to come. Yeah, so it's tomorrow night, 6 p.m. There's a weekly Twitter chat. It's the fastest hour of your life. You can see what the diabetes community is talking about and what they're enthusiastic about for that hour. I'm on Facebook. They are everywhere again. We are everywhere. For example, the CGM in the Cloud Facebook group, if you want to look up something, you write down this URL, nightscout.info. These people are pretty impressive in what they're going to do. If you want to speak with me about it afterwards, I can talk with you for about 2 hours about what they're trying to accomplish. But that Facebook group is over 13,000 people, and they're very enthusiastic and engaged patients and patient advocates. They're blogging, WordPress, Tumblr, Blogger, whatever your platform of choice is. They're out there writing their personal stories, connecting with the rest of the world that are looking for other peers to try to understand their story. We really are everywhere. And it's a pretty incredible thing to know that virtually any time of day I can go to whatever social network I'm looking for and find somebody out there and connect with them, and they know exactly what I'm going through. And it's a pretty powerful thing to know that I'm really not alone. Which leads me to My Diabetes Secret. If you know about PostSecret, the postcards and submissions, Frank Morey's got like 12 books and the website. Everybody's a big fan of that stuff. It's a pretty big deal. I created My Diabetes Secret in the vein of PostSecret. It's a safe place to share your diabetes secrets anonymously. There's no judgment, no shame, no stigma, merely catharsis through honesty. I launched this a couple of years ago, October of 2013. And it's kind of strange because one person randomly, this is a weird tangent, so one person had a blog post saying, hey, I saw this on PostSecret, it related to diabetes, what do you think about it? I'm going to enable anonymous comments in case you guys want to share something. This is before I actually launched My Diabetes Secret. That post had 250 comments on it. This is somewhere else on 6untilme.com. And that was actually the inspiration for creating a more kind of evergreen platform for people to share whatever they're feeling anonymously. It kind of blew up a little bit. It's been kind of wild to see this thing grow. I've got a couple of examples of submissions. One of them does talk about suicide a little bit, so I had to put this trigger warning up there in case you are going to be sensitive to that stuff. I'm just going to read some of these, and as I go through these, one of the things to keep in mind is that I'm reading every one of these submissions. I personally approve all of them to go through the queue, and I'm going to talk about the mechanics of the site and how it works and what I've done to try to streamline it and improve it a little bit. But I want to give you an idea of what people with diabetes are actually experiencing out there. I'm so tired of being broken. It's such a mental drain of knowing that your body of knowing your own body isn't working like it's supposed to, and there's not a damn thing you can do to fix it. Diabetes makes me feel like I'm supposed to be dead. My own body tried to kill me, and I don't belong here anymore. Sometimes I wish I never would have been diagnosed. I wish I would have just died, because sometimes that just seems better than having to deal with this disease every day for the rest of my life. Yesterday I woke up and my blood sugar was 60. Normal blood sugar is between 90 and 120. That's what I'm normally aiming for. Just to give you a little context for that. I sat in bed and stared at the ceiling until I was under 40 and thought about how close I was to zero. And then I drank a juice box and went to class as if I hadn't just had an intimate experience with death. And yet people still tell me diabetes isn't a big deal. Sometimes I actually do resent my child with diabetes. Then I hate myself for thinking that. All I want to be is normal. So that's a small sample of the stuff that I get to read more or less every day. It's a little bit wild, and you can't. It's difficult to see this. I thought my monitor's gonna be a little bit bigger, but I built this thing on Tumblr, which hopefully in San Francisco, so you guys probably have an idea of what that crazy network is like. Tumblr's a really weird place. Some of the main interactions on Tumblr, you can either follow the blog, you can like it, similar to Facebook, or you can reblog it, resharing it on your own blog. The common thing that I see on My Diabetes Secret, because I obsessively check the notes every single day to see what people are interacting with, you'll see at the bottom down here, I wish I had a mouse, at the bottom that's somebody who just started following the blog. What follows after that is a spree of likes and reblogs. And that indicates to me that they're saying, hey, I can relate to that, me too, and then just going to go through and connect with a whole bunch of other posts. And this happens pretty regularly. Almost every time somebody new follows the blog, there's a spree of that same person just scrolling through pages and pages of content because it's connecting with them. It's a pretty cool thing to see. Especially, like I said, I obsess about the stats and things like that, so it's a weird thing for me to obsess over. But seeing everybody else connecting with it makes me feel like I'm still doing something good for the diabetes community. As of yesterday, or 2 days ago, whenever I finished these slides, I had over 800 submissions and over 3,100 followers. And that's, I think that's good. Like, I don't have any basis of comparison. This hasn't really been done before, but I thought that 3,000 number was a pretty big deal. So I've been using Tumblr, as I said, as a primary platform. I'm cross-posting to Facebook and Twitter. I'm using if this, then that to queue up posts and things like that. So I'm doing what I can to use all the social hooks out there in the world to kind of spread this content as wide as I can without being too obsessive about it. Like, I'm not just going to be like tweeting and telling everybody like, hey, go submit, go submit, go submit. But if it's out there, I want people to be able to find it organically. And that's kind of what I've been able to accomplish so far. Over the course of the existence of this blog, it started out as just the regular Tumblr submission form, which is kind of built natively into the platform, which is why I selected Tumblr. Having that form there was really great. But I wasn't necessarily prepared for some of the submissions that came through, like the stuff about suicide. So I had to kind of evolve how I dealt with the site and how I manage my own self-care. So now I don't read submissions after 8 p.m. just in case they're kind of deep and I don't necessarily want to go to sleep with that on my mind. To that end, I created a resources page, which is kind of difficult to see, but there's a resources link to mental health professionals because I'm not equipped to deal with this stuff. And also, these are all anonymous submissions, so even if I wanted to intervene, I can't because they're coming in from anonymous@gmail.com as I instructed them to, because I want them to feel safe that they're not going to be tied back to anything that they're submitting. But if they're looking for help, this is right now the best that I can do to reach out to them and say, hey, if you want to talk with somebody who can actually help you, here's what we've got going on for you. I recently started a peer resources list because I had been receiving a number of submissions saying, hi, my name is Chris. I'm also living with diabetes. If you want to talk, here I am. And I can't post that because that's their name, that's their persona, that just doesn't work. But enough submissions came in to the point where, okay, I need to build some kind of a blog or some kind of a list of people in case they actually wanted to connect with their peers out there. And that's a slow building thing, and I'm not necessarily sure if that's working. I'm not sure if that's the best way to go about it, but as you probably know, as you're all probably designing things left and right, designing some kind of health system is an iterative process, and I'm just trying to figure out what's the best way I can actually do all this thing out with the community. The last thing I added at the bottom of each of these posts, it started about 4 months ago. I added direct links to the submission form and the resources page at the bottom where it says, share your secret, these resources may help. Every time a post comes in, I manually edit that in there because as I was looking at the Google Analytics, the resources page wasn't getting a lot of traffic for the first 2 months that I had it up there. I made a post saying, hey everybody, it's here if you need it, but nobody was clicking on it. in part because it's in the header and everybody ignores the header. That's just the basic of web navigation. But again, because there's no direct way for me to intervene, I had to do whatever I could to try to put those resources in front of as many eyes as possible. So including every single post as it's reblogged, it's getting out there. And I don't actually have a graph for the Google Analytics, but since I made that change, the resources page has been getting a little more traffic. I don't necessarily know if people are clicking on the links or dialing the phone numbers, but I feel a little bit better knowing that that design change actually made a difference as far as exposing those resources and exposing people in case they need help to those resources if they need them. And that is where the design sort of evolves a bit. I had this idea, or this question, why isn't there a My Cancer Secret? And this is where, if you have questions at some point, please start asking them, because I'm going to have questions for you as well. The idea was that if my diabetes secret worked, why couldn't my cancer secret work? Why couldn't my arthritis secret work? Why couldn't my chronic disease secret work? So I tried it. I contacted a bunch of people, some of whom are on the executive board and on the patient advisory board for Medicine X. Medicine X was another plug. I met a number of people from a wide range of diseases communities. Prior to Medicine X, I only thought it was just diabetes out there, but then I met people living with cystic fibrosis and things like that, and understanding that some of the conversations that we're having in the diabetes community, they're having in the arthritis community, and they're having in the CF community, and they're having in the chronic pain community, and there's a weird kind of symmetry there. But I knew I wasn't equipped to deal with what could possibly be coming in from those communities, so I reached out for help, and I said, all right, how can we reach everybody? It was a pretty ambitious goal, and I encountered a couple of interesting kind of design challenges, I suppose. First thing we did was build a list of chronic diseases that we felt we could reach, regardless of what we thought the popularity of those disease communities was on Tumblr. Came up with a list of, what am I going to say, 65. From there, I tried to incorporate those diseases into the Tumblr submission form. It turns out you can only get 30 tags in a submission form by default, so we had to take 65 and say, all right, what are the 30 most important, which is an impossible task. And that was something I still wrestle with, because I know that people will come to this page and feel left out as a result of that, and I don't know how to fix that. In building that list of 65, bringing it down to 30, I then, knowing that I wanted to reach as many people as possible on places like Twitter, I built out a list of common hashtags that each of those diseases are linked with. Some of them are disease community chats, some of them are just diseases themselves. And I built out a whole list of automated triggers for if this, then that, to try to broadcast it everywhere. That design itself has evolved a couple of times, because I realized that if a submission came in on multiple tags, the if this, then that's going to trigger for 9 Twitter posts consecutively, and it just starts flooding everybody, things you're not necessarily going to anticipate at the moment. So I had to, it feels really nerdy talking about this like that, but we're in San Francisco. So I've got Tumblr will get the new submission whenever it goes live. If this, then that, sends it. Each one of the Twitter posts goes to Buffer, and Buffer is going to send them out every hour as a result. So it's actually kind of what Buffer is built for. And I felt kind of smart when I figured that one out, but it just, I don't know. It feels really nerdy talking about that, but I feel like I'm among my people in San Francisco, so we're okay to talk about going from Tumblr to Buffer to Twitter to Facebook and all these other things. So that's part of the broadcast bullet point right there. So it's, if somebody comes out on a chronic pain and an arthritis and a depression, tweets are going out on chronic pain, Spoonie chat, chronic life, depression, mental health, mental disease, chronic disease. I think there was one more. Something like that. But basically, I'm trying to promote to as many communities that are hopefully paying attention to these hashtags as possible. So I launched this thing. Here's a fun fact. So this tweet was sent out on February 23rd, and I launched this site on 3 days later, or a version of it on mydiseasesecret.com. And I thought it was going to be great, because if diabetes is just one disease and I have all these followers, all these submissions, it's great. Clearly, if I'm going to try and reach 30 different communities, it would work just as well, but 30-fold, right? Wrong. This graph on the left is my chronic disease secret. Over the past 30 days, these are Tumblr notes, so the likes or the reblogs. And the scale on the y-axis, there's in increments of 10. On the bottom is my diabetes secret. Over the past 30 days, it's been around longer, so you have to take that caveat. But the scale on the y-axis is 200, not 10. So you see the bumps in the graph, but just think about the increments and the values there. My diabetes secret is blowing my disease secret out of the water. And I don't know what to do about that. And this is where I'm asking you guys for help. It's selfish that I'm asking you for help on my own, master plan here. I don't know what to do about how to reach all these people effectively, and it's a bit of a bummer. So if I at times, almost daily, I wonder if my goal was too broad, if I should have just simply started with my cancer secret first, and then see if I can reach the cancer community. Obviously, there are a variety of different cancers out there. I could probably reach each one different. Breast cancer, lung cancer, those communities are a little more vibrant than others, for example. I often wonder if the diabetes community is just an anomaly as far as online community interaction when it comes to disease communities. I know it's not necessarily true, but I've heard from a number of people in their own communities saying, I wish we were more like the diabetes community as far as their passion, their numbers, their enthusiasm, and things like that. It's not necessarily self-congratulatory, but there's just a different problem there when it comes to some people don't necessarily want to talk about depression online, or the breast cancer community is only on Twitter, they're not on Tumblr, or the arthritis community is only on Facebook, they're not on Twitter. These are things that I didn't necessarily anticipate occurring. As a result, I've done things like squat on a bunch of URLs, like mycancersecret.com and myarthritissecret.com, because I'm not sure if the umbrella site isn't going to work because it's too broad. Maybe I need to design out the same approach for my diabetes secret, but actually target those individual disease communities. I'm not sure if that's going to work either, but I've spent $52 potentially anticipating that it might work. I don't know. And I just, like I said, I'm not sure if the umbrella approach is the right way to go. I mean, sometimes I think if I'm being a little unfair to the rest of the chronic disease community, because diabetes gets its own little site, and everybody else, you all get the umbrella. You guys get to share the, you guys get to be on the playground together. Diabetes gets its own little separate, exclusive spot. Sometimes I think I'm being a little unfair to everybody. So where do wow, these slides are really poorly designed. They looked a lot better when I put it on my computer, sorry. So where do we go from here? Does an anonymous sharing platform only benefit the diabetes community? I don't think so. But if it doesn't, how might we better engage these other disease communities? How might we improve on the task of providing a platform free of judgment, shame, stigma, and identity to the larger chronic disease community? How might we? Anybody? It's okay if you don't have any options, but I came here kind of looking for maybe a little bit of a different perspective, because you guys don't live with this in and out, and I don't expect you to, and that's fine. But coming at this fresh, what would you do, any of you, what would any of you do to try to actually reach the broader chronic disease community? Do you think separating it out would be better? Yeah?
Separating it out is definitely better. I think also some of the people suffering from the disease don't consider themselves having a chronic disease, and they look for a cure. And so maybe they wouldn't even know how to, that's not something that they would go to. That's not the term that they would use for what they have. And I think with diabetes, people are looking for a community, and so I think people with very separate diseases maybe don't see the community in general around disease.
So if some people don't necessarily associate with their diagnosis right away, if they have to come to that acceptance, thank you for that comment first. If they don't necessarily come to that acceptance right away, do you think that coming to an individual site of a bunch of people with breast cancer talking about it, would that be, what kind of difference do you think that would make for that kind of first impression?
I think people just see comfort in people that share their specific experiences, and so, like, for example, someone with breast cancer will find comfort in other people with breast cancer. Because someone with breast cancer probably doesn't really care about someone with arthritis in the sense of like speaking to a community, and so that's why the specific sites are, I think, much better for people in like separate disease categories.
Thank you. Anybody else have a thought, comment?
So maybe there are people from medical consumer marketing in the room that would be a lot smarter than I, but actually diabetes type 1 patients are kind of considered a little bit of an outlier for a lot of medical sort of marketing things, because they appear to be some of the most committed patients and some of the most involved patients in terms of staying on top of what's going on, trying to help themselves, actually being very serious about taking their conditions and try to live life because they're young, because they're typically well educated, and really they got the disease not as a result of sort of lifestyle choices or mistakes that they've made in prior 50 years. So I would recommend that you definitely split the community into different disease states and looking for similarly active and similarly sort of committed patient populations.
I like that you think I'm well educated. Thank you.
Hi. So basically, kind of on the lines that she was saying, is that if it's just an umbrella of chronic disease, then they're going to not really feel like they're related to. So somebody that has cancer wants to be able to relate to other people that have cancer because they understand that, they think that they understand them better. Whereas somebody has arthritis, it's a totally different disease. So I think that even if you don't have it down to specifically, okay, lung cancer or breast cancer, but if it's just like under cancer, then they'll be able to relate to each other. So you don't have to have it's endless, that you could, have so many groups, or there's so many different kinds of arthritis, or what have you, chronic diseases. But if you just have it more, a little more specific, but you don't have to have so specific.
I would have 2 points. First of all, you compare oranges to apples when you look at graphs with how many people are involved. You can never compare the community which you grew for a while with a new one. It never happens in marketing. So the trends actually, at least from here, they look pretty much the same. So you can at least say that people react the same way to any post you have. And my second point being that cancer people are separate because it's unfortunately not a manageable disease. It's terminal disease very often, and you can never predict it. Versus diabetes, arthritis, and all others, you can live with them very long. So people who live long with certain disease have very different response rate from those who actually fight for their life. And I think you have to compare these points and think about it when you do the strategy.
Thank you for that. And yeah, I knew when I put those graphs up there that was going to be a challenge. If I could have gone back to a few months after the launch of My Diabetes Secret, I wonder what that graph would have looked like. I still feel like the overall interactions have improved or are better on My Diabetes Secret, but I think it's in part because of what you're talking about, because I treated all these other diseases as kind of one, whereas diabetes got to be its own separate thing.
Hi, thanks for sharing. My name's Jacqueline. This is wonderful. I thought there was a lot of great feedback. I especially agree with that it is a mistake to put them all under the same umbrella because each chronic disease has its own unique patient experience. And people, I'm a designer, and so I'm looking at this through the lens of UX. What happens when you become too general with your design and try to meet the needs of too many different diverse types of audiences, then you kind of dilute your product and you don't really meet the needs of anybody. And I agree with the person who said to try to focus on a community that is also as active, because as a design researcher in healthcare, we know that type 1 diabetic patients are the most motivated, most active in their self-management, because if you don't, you die. So that's the reality. So the third point is that it's called my chronic disease, and not all of the chronic illnesses that you mentioned, the patients don't like to think of themselves as having a disease or being ill. For example, people with depression. So people don't want to be reminded that they have a chronic disease, and so part of the problem is the language that you're using.
Thank you. Yeah, as I'm hearing all of your feedback, I'm going to walk back to you as I'm talking. As I'm hearing all your feedback, I'm just thinking about all the ways that I sort of applied the existing My Diabetes Secret template and assume that I can change a few names and everything else is going to be the same. Getting a lot of slack. I'm coming back to you in a second. No, it's fine. This is fun for me. I get to walk around. Here we go.
A lot of doctors can prescribe medications and exercise and all that, but they don't necessarily have a website to prescribe. So it would be lovely for them to be able to refer their patients to your site. You just have to get the word out, maybe. That could be an option, just market to the doctors and the healthcare professionals taking care of these patients.
Yeah, as I was playing this out and looking way far ahead and assuming I was going to get thousands of posts a day, I had grand ideas of categorizing all of the submissions on various kind of mental health, as far as like anger, rage, and those types of categories to say like, okay, at some point I can present some research and numbers and data, and I can be really awesome and professional, and everybody's going to take me seriously. But of course, without the data, then what good is it going to do? I still think that there's something there because, in particular, the diabetes side of things, mental health. I've got 3 minutes. The mental health side of diabetes is often, there's a big stigma around that kind of, there's a big stigma around mental health and treating that in general, but the diabetes community, we have a lot of problems talking about that stuff, and finding a way to address that in a tactful way has always been a challenge, and there's a lot of stuff for me to go back through at some point if I do decide to do that, but I wonder if it's actually worth saying, okay, well here, based off of this very small sample size, here's what people are feeling. I don't know if that's actually going to work, but it's something that I have rolling around in my head. I've got 2 minutes and 40 seconds left on my timer. Anybody else have a thought, comment? Oh. Yeah. We're making the camera work too. This is a lot of fun. There we go. Sorry. Okay, thank you.
Yeah, so this might not be what you want to hear, but my guess is this won't scale to other sectors. I've worked in lots of different areas of medicine, and I've never seen a committed, dedicated population like the type 1 diabetes community. They live with this disease for decades, and a single slip could mean them going into hypoglycemia versus diabetic ketoacidosis, which is not typical of most other conditions. Those other conditions, even if you look at breast cancer or something like that, you have somebody that's diagnosed, and then they go through this horrific ordeal, and either they are in remission or they die. Whereas diabetes, it's a matter of day-to-day, making sure you're dialed in every single day. And the community that I've seen, are you familiar with Glue, My Glue? Yeah. So it's, the community there is just so robust. And I have some suggestions for potential people that could provide grants to My Diabetes Secret as well if you're interested. But I'm working on an artificial pancreas myself, though.
We should have a more thorough conversation after this. Okay. I think that's all I've got. Unless there are any other comments. Thank you for your feedback. Even if a number of times I've just heard that I've done it wrong, this is actually what I was hoping you guys would tell me. It's really encouraging to know that even though I went down one path, it's okay for me to kind of change it up and not necessarily break it all down, but figure out how to fix it moving forward. So maybe I'll come back in a few months and say thanks to all of you. I did this, this, and this. So thank you for your feedback. I really do appreciate it.